We need supplies desperately, and we're working on that. We just had a very good meeting where we discussed supplies. I want to thank Michael Evans from Alibaba, who's here with us today. I want to thank Elizabeth Jennings from the Asia Society, who's here with us today, who are helping us source supplies, because we're in a situation where you have 50 states all competing for supplies. The federal government is now also competing for supplies. Private hospitals are also competing for supplies. So we have created a situation where you literally have hundreds of entities looking to buy the same exact materials, basically from the same place, which is China, ironically enough. And we're fighting amongst ourselves. We're competing amongst ourselves. We're driving the prices up. When we started buying ventilators, they were under $20,000. The ventilators are now over $50,000 if you can find them. The ventilators didn't change that much in 2 weeks. The prices went up because literally we are driving the prices up. But we need to give our front line, our healthcare professionals, the supplies they need, and we need to do it now. Our rule here in New York has been plan forward to get ahead of the problem. The old expression is don't fight the last battle. This virus has been ahead of us from day one. We have been playing catch up from day one. You never win playing catch up. Get ahead of the problem. Don't fight today's fight. Plan for 2 weeks, 3 weeks, 4 weeks from now when you're going to have the apex, and make sure that we're in a position to win the battle when the battle is truly drawn, which is going to be at the apex. That's why we are preparing stockpiles now. We're building a stockpile. The word stockpile, by definition, means not for immediate use. It means you're preparing for a battle to come. And you have to have the equipment, and you have to have it now. I've done disaster work all across the nation. I can tell you this. If you wait to prepare for the storm to hit, it is too late, my friends. You have to prepare before the storm hits. And in this case, the storm is when you hit that high point, when you hit that apex. How do you know when you're going to get there? You don't. There is no crystal ball. But there is science, and there is data, and there are health professionals who have studied this virus and its progress since China. We now have months of data. Listen to the scientists, listen to the mental health, the healthcare professionals, and follow the data, and that's what we're doing here in New York.